So what's so magical about turmeric? This is Dr. Nav Sharda. Patients are always asking me why I'm recommending turmeric to almost everybody. And there's many different reasons for it. Not alone because it's part of a curry spice, and of course it makes food taste very good. But there's a lot of medical reasons for it as well. Turmeric is an incredibly interesting compound because it has a lot of it has multiple beneficial effects in the body. One of the most beneficial effects in the body in terms of cancer treatment is obviously it improves a person's ability to tolerate chemotherapy and radiation therapy. There's a mechanism by which turmeric has been proven in many different medical, clinical studies, as well as laboratory studies, and that is that turmeric improves the ability of normal cells in the body to tolerate radiation therapy and chemotherapy damage to their DNA. Now that's pretty important because one of the major side effects of treatment is that although we're damaging the DNA of cancer cells, we're also damaging the DNA of normal cells. Normal cells have enzymes, however, that allow the cell to identify the damage to the DNA and to repair it. Cancer cells have lost that ability. It's called the p53 mutation. And so without an active protein 53, the cell does not recognize the DNA damage, and unfortunately the consequence of that would be the cell turns into a cancer. So if eating just a small amount of turmeric every day improves your normal cell's ability to recognize DNA damage and to repair that DNA damage, then obviously patients will benefit during their cancer therapy. Some of the other reasons that we recommend turmeric, that I recommend turmeric particularly, is that it's also been demonstrated to be a very strong anti-inflammatory. So for patients who have, let's say, COPD or emphysema or lung cancer, the benefit of turmeric is that it is almost as good as an anti-inflammatory as a prescription medicine called prednisone. Now, prednisone is a great medicine, but it does have side effects. And chronic use of prednisone has been demonstrated, I mean absolutely demonstrated, to make diabetes worse or actually cause people to become diabetic. It also reduces their muscle mass and it reduces the bone strength. So there's a lot of bad side effects to a chronic use of prednisone. However, we don't have any of those bad side effects from using turmeric. So there's a whole lot of reasons that I really would like patients to take turmeric. And these are just some of the reasons, some of the most obvious reasons. There are many others, and we can talk about all that during your visit. If you have a different oncologist, just make sure that when you go and see that other oncologist, that you discuss whether or not turmeric would be beneficial for your particular cancer. Okay, so to your health, this is Dr. Nav Sharda at the Cancer Care Centers in Las Vegas.